Another aspect of planning surgery is the implant placed in front of the muscle or behind the muscle? Now, that's something people look at photos and think they can tell sometimes, but it is very difficult. Now, there's pros and cons for both. If you put the implants in front of the muscle, you will tend to see a lot more of the upper part of the implant. It'll be more obvious. Going under the muscle pads that a little bit, so you have a more gradual transition from chest onto the breast. Now, in front of the muscle also has a higher risk of one of the complications of surgery, which is capsular contracture. Under the muscle, you're slightly less. So Australia Cosmetic Clinics is made up of multiple surgeons. Each surgeon is going to have a preference of where to place the implant. My preference is under the muscle in most cases, although for patients who are looking for that more augmented or over-the-top look, going in front of the muscle is fine as long as their anatomy suits it. I think the placement of the implant is a decision that comes from both the surgeon and the patient. So it's about educating the patient on the pros and cons and then deciding what look ultimately the patient's after. So one of the most common misconceptions about high-profile, extra high-profile implants is that they come up higher on the breast. Now, the placement of the implant is dictated by a patient's anatomy, and the profile merely relates to the base width of the implant and the projection. It's the relationship between those two things that makes up a profile. So a moderate profile, for instance, is a wider implant with flat or low projection. High profile implants are a little bit narrower with more projection, and extra high, once again, even more narrow and more projected.
Cool. So how does knowing that help a patient?
Well, profile is not something that you plan for. It's something that is resulting from your measurement of the patient and decision on volume. And then it works out to be, it's a high profile or it's an extra high profile.